came to Dr. Harris, I was experiencing total fecal incontinence. I couldn't control my bowel at all and had about 30 seconds notice before I would have a bowel movement. A person, as a counselor, I know that a person is the sum total of all the roles that they play. A person's identity comes from those roles, and their self-esteem comes from how well they play those roles. I was devastated. Because I had total incontinence, I couldn't play any of those roles. I couldn't do my job, I couldn't be with my family, I couldn't do anything. And I was at the point where I was suicidal. I have to be honest. I have often wondered with clients when they would say that they were suicidal and that they couldn't live anymore. I would have lots of empathy with that. But I didn't really understand it because I always thought, well, no, you've always got a reason to live. But I was at that point where I thought I have no quality of life left. And I didn't want to live. When I first met Dr. Harris, I was so surprised because I knew that I was being referred to a specialist in this particular area. And I'm an older lady and I've seen lots of doctors, and I thought that I was going to go see somebody that was in a starched white coat and was very clinical and very cold and very matter of fact, and I was so surprised because he was such a warm, caring man. Everybody from the front office to the back office, everybody welcomed you and made you feel like they were here to help you, and so I was delighted. To get ready for all this, it's a three-step process. The first process was a testing procedure to see if I had a nerve problem or if I had a muscle problem. I came and met Mary Margaret, the technician, and she was wonderful. If you can say it, we had a good time together that day. You sit in a special chair that slightly reclines, and they test the different pressures and different sensations. And something that could have been a very invasive, very embarrassing, horrible procedure was not. It was over in just a few minutes. We laughed, we had fun. It was not a bad time at all. With my diagnosis, there was a problem with the nerves. Then we consulted with Dr. Harris and we decided to try the Interstim implant. I came back to the hospital and was admitted for an outpatient procedure. Put the little gown on, got the shots, went off to Happy Land, and I woke up with the leads already implanted in my pelvis. A little wire came out of my back and was attached to the Interstim device, the control device, which I wore on my hip for a couple of days. Dr. Harris had said that may take up to 2 weeks to determine if it was effective. We knew immediately that the Interstim device worked 100%. 5 days later, I came back, went back to the women's hospital, was admitted. They put the permanent leads in, implanted the device in my hips, sewed it up. I was home in an hour, and the rest of my life has changed 100% since then. After the surgery, everything changed. Everything changed. I have lost 30 pounds. I feel great. I can go anywhere I want. I am now a mother, a daughter, a sister, a grandmother, a friend, a wife, a lover. And you know, I have to tell you, people don't talk about it, but my problem had gotten so bad, I was afraid to have sex with my husband of 42 years because I was afraid that I would have a bowel movement in the middle of that. Everything has changed. Everything about my life has changed. I feel like a totally new woman. It's amazing. If I could tell somebody that was having the same symptoms, first of all, I'd say don't be embarrassed. As time has gone on and I talk to more and more people about this, I find out that I was not the only lady taking a diaper bag around with them. Because you never knew if you were in the middle of the mall, if you would have an accident and have to go to the bathroom and clean up and change clothes. A lot of ladies do that, I found. Those big purses have more than just telephones and perfume and lipstick in them. Don't be embarrassed. Go to somebody that really knows what they're doing and get help, because your life can be changed in a day's time. The Interstim device has given me a quality of life back. It's given me back. It's given my husband his friend back. Interstim is such a tiny device, but it does such a big thing in people's lives. And that's what I would tell people is, number one, don't be embarrassed. Number two, go to somebody that knows what they're doing and that has the type of environment like Dr. Harris has, where you feel good about yourself. And number three, get the Interstim. It works.